The mission of the HIV Media University is to educate journalists on the causes and effects of HIV/AIDS. HIV-MU encourages journalists to address HIV/AIDS by voicing out on the epidemic in their communities that they serve. AIDS is a story of great breadth and sharp contrast. Complex stories covering it require knowledge and sensitivity around personal issues such as sexuality, addiction, and social vulnerability. It is a global story requiring a broad understanding of international politics, economics, and diverse cultural traditions. Interwoven with these strands of the AIDS story are the scientific, medical, and healthcare stories, which you as a reporter must be able to translate for the general public. That's what makes it complicated, says Renata Simone in the HIV/AIDS Reporting Manual. How can the media help? The media plays a significant role in the fight to eradicate AIDS. It is often stated that the vaccine against HIV is education. HIV-MU is a 10-week program which requires journalists to attend a weekly 3-hour lecture. The curriculum is designed to supply journalists with an overview of HIV/AIDS, health policy, and new media skills. During the course of the 10-week training, journalists will learn about the who, what, where, when, and how of HIV. Journalists will also gain knowledge of where they can get resources on HIV/AIDS. Journalists will also come up with possible story ideas. Sample lectures include who, what, where, when, why, and how of HIV stories and reasons to report on the pandemic, multimedia skills in reporting on HIV, how the government affects HIV, follow the money, what healthcare reform means for HIV. The training will include lectures by special guests. Past guests include William Clinton, President of the United States from 1992 to 2000, Phil Wilson, CEO and President of the Black AIDS Institute, and Helen Gill, CEO and President of CARE. During the 10-week training, journalists in the program will blog once a week on an HIV-related story to be featured on the website journalistforchange.org. Journalists will also create 5 30-minute podcasts and 2 videos also to be showcased on the website. Sponsors and supporters of the HIV Media University include the Black AIDS Institute, the Mayo Clinic, the United States Centers for Disease Control and Prevention. In order to provide necessary training for those in the media, Journalists for Change is requesting funding from the Henry J. Kaiser Family Foundation. The proposed HIV Media University program will establish a network of journalists trained on HIV/AIDS and new media skills around the United States. Journalists for Change estimates the cost for the program, including fees for speakers who will provide training, equipment, and facility costs, will total $125,000 per year for 3 years. Journalists for Change envisions the Kaiser Family Foundation as a lead sponsor of this program with an estimated commitment of $75,000 per year. Journalists for Change plan on raising the additional funding to support the program through selling advertisement on their website and other sources. Journalists for Change is asking the Kaiser Family Foundation to become a leader and help eradicate AIDS.